Today I want to talk about bulimia. It's a heartbreaking eating disorder that affects millions of people. 90% are women, and unfortunately, all too often, we see it affecting teen girls. The definition of bulimia nervosa is a recurring cycle of binge eating followed by purging. Now, the people who suffer from it eat huge amounts of foods, often in secret because of the shame, and afterwards they feel so guilty and so scared of gaining weight that they make themselves throw up to get rid of the food. There is no single cause for bulimia, and it's certainly not a willpower issue. But these factors play a role. They're terrified of gaining weight, they are obsessed with losing weight, and they're never happy with their bodies, even though they may look completely normal. Bulimia seems to run in families, either because of a mother or sister that has bulimia, or because there's a real unhealthy emphasis on weight and dieting in the household. Stressful episodes like being teased about body size or a traumatic event like a rape can trigger bulimia. In some cases, the vomiting becomes the goal in itself. People will overeat just so they can vomit. As unhealthy as this is, it gives them a sense of control and temporary relief. There are warning signs you should look for. Taking pills to urinate or have bowel movements. They may fast or exercise way too much even when they're hurt. They go to the bathroom frequently after eating so they can throw up. In addition to the emotional toll, bulimia causes all kinds of physical damage. The vomiting can tear and damage the esophagus, weaken the heart muscle, can cause ulcers, intestinal problems, irregular menstruation, hormone imbalance, and dehydration. Bulimia cannot be ignored. A person suffering from it needs help right away. The most effective treatment is behavioral therapy to break the binge and purge cycle. The person basically needs to relearn how to eat, and they need to learn how to cope with the stresses that drive them to binge. The antidepressant Prozac can work in helping to treat bulimia because it helps in treating the anxiety and depression that often accompanies it. But if there's one message I want you to remember, it's to find help for yourself or someone you love who is suffering. For more information on bulimia, you can call the National Eating Disorders Association hotline at 1-800-931-2237 or go to www.nationaleatingdisorders.org. Of course, there's also information on Dr.